Tendon is an example of A. Dense regular connective tissue, B. Loose connective tissue, C. Dense irregular connective tissue, D. Specialized connective tissue. And the correct answer is A. Dense regular connective tissue. Tendon is an example of dense regular connective tissue. Tendons, like strong ropes, connect muscles to bones for movement and stability. Dense regular connective tissue makes tendons tough and resistant to stretching. When we move, muscles contract, pulling on tendons to create motion. Tendons help us run, jump, and perform daily activities requiring strength and coordination. Which area of the brain is primarily associated with Broca's aphasia, a condition affecting language production? A. Temporal lobe, B. Occipital lobe, C. Parietal lobe, D. Frontal lobe. And the correct answer is D. Frontal lobe. Broca's area is a part of the brain controlling speech production. Broca's aphasia is a language disorder affecting speech fluency and grammar. It's often caused by damage to Broca's area, usually from stroke or injury. People with Broca's aphasia have trouble forming complete sentences and may struggle to speak. They can understand language but find it challenging to express themselves verbally. The area of the brain primarily associated with Broca's aphasia is the frontal region. What are the three main types of latherism? A disorder associated with the consumption of certain legumes. A. Lathyrol, osteocalcin, angioside. B. Neurolatherism, osteolatherism, angiolatherism. C. Lathyrus major, Lathyrus minor, Lathyrus grandis. D. Lathyrine A, Lathyrine B, Lathyrine C. And the correct answer is B. Neurolatherism, osteolatherism, angiolatherism. Latherism is a disorder caused by excessive consumption of the legume called Lathyrus sativus. There are three main types of latherism: neurolatherism, osteolatherism, and angiolatherism. On which date is World Food Day celebrated every year worldwide? A. October 10th, B. October 16th, C. October 21st, D. October 31st. And the correct answer is B. October 16th. World Food Day is a global event celebrated on October 16th annually. It aims to raise awareness about food security, hunger, and nutrition worldwide. The day promotes actions to ensure everyone has access to safe and nutritious food. It calls for reducing food wastage, improving agricultural practices, and fighting malnutrition. World Food Day reminds us of the importance of working together to end hunger. Which of the following conditions is the Chvostek sign commonly associated with in clinical medicine? A. Hyperkalemia, B. Hyperglycemia, C. Hypocalcemia, D. Hypernatremia. And the correct answer is C. Hypocalcemia. Chvostek sign is a medical test used to check for facial nerve irritation. A doctor taps on the patient's cheek near the earlobe lightly. If the patient's facial muscles twitch or spasm, it's considered positive. This sign can suggest an underlying issue such as calcium imbalance or nerve problems. It's important for doctors to evaluate and diagnose any concerning results. Kernicks sign is a clinical test primarily used to assess for which medical condition? A. Hypoglycemia, B. Meningitis, C. Hypokalemia, D. Asthma. And the correct answer is B. Meningitis. Kernicks sign is a test used by doctors to check for meningitis. It assesses the stiffness of the hamstring muscles and the ability to straighten the leg. In this test, the patient lies flat on their back with the knee bent. When the leg is slowly straightened, pain or resistance can indicate meningitis. Kernicks sign is one of the clinical signs used to diagnose this serious condition. Which disease is characterized by the presence of Hermits sign? A unique sensation described as an electric shock like feeling radiating down the spine and into the limbs when the neck is flexed. A. Multiple sclerosis, B. Parkinson's disease, C. Alzheimer's disease, D. Rheumatoid arthritis. And the correct answer is A. Multiple sclerosis. Hermit's sign is also known as Hermit's phenomenon or barber chair phenomenon. Hermit's sign is a sensation like an electric shock when bending the neck. It's often felt radiating down the spine and into the arms or legs. This sensation occurs due to damage to the spinal cord or nerves. Hermit's sign can be a symptom of conditions like multiple sclerosis. It's important to consult a doctor if a person experiences this unusual sensation. Which of the following condition is known for causing clubbing of the fingers and toes, characterized by abnormal enlargement of the nail beds and fingertips? A. Diabetes mellitus, B. Hypothyroidism, C. Cirrhosis, D. Pulmonary fibrosis. And the correct answer is D. Pulmonary fibrosis. Typically, nails form a gentle curve, but in clubbing they become rounded. It's a sign of low oxygen levels in the blood. This condition often accompanies lung and heart diseases. Doctors use it as a diagnostic sign. Multiple cafe au lait spots are a characteristic feature seen in which of the following disease conditions? A. Vitiligo, B. Albinism, C. Neurofibromatosis, D. Psoriasis. And the correct answer is C. Neurofibromatosis. Cafe au lait spots are light brown spots on the skin. They can vary in size. The name means coffee with milk in French, describing their color. These spots are caused by an excess of melanin, the pigment that gives skin its color. Sometimes they may be harmless and may be present from birth. However, multiple cafe au lait spots can be a sign of certain medical conditions. Doctors may examine them to check for underlying health issues like neurofibromatosis or other syndromes. Dupuytren's contracture primarily affects which part of the body? A. The knee joint, B. The spine, C. The hand and fingers, D. The ankle. And the correct answer is C. The hand and fingers. Dupuytren's contracture is a condition in which the fingers, typically the ring and little fingers, become permanently bent in a flexed position. This is due to the thickening and tightening of the connective tissue in the palm. This condition can limit finger mobility and affect hand function. Micrognathia is a medical term that refers to an abnormally small A. Upper jaw, B. Lower jaw, C. Overbite, D. Misaligned teeth. And the correct answer is Drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.